How does autism stigma vary across cultures? Have you ever wondered how different cultures view autism? The stigma surrounding autism can change dramatically depending on where you are in the world. This difference is shaped by beliefs, values, and social norms that influence how autism is perceived and understood. In many cultures, especially in some immigrant and non-Western communities, autism can be linked to shame or discomfort. For instance, in Korean American communities, parents may feel pressured to hide their child's diagnosis to avoid facing social judgment. This stigma often stems from limited awareness and misconceptions about autism. Some people might think that autistic individuals are just socially awkward or less capable. Such views can lead to isolation for both autistic individuals and their families, making it harder for them to access support and resources. Cultural norms also play a big role in how behaviors associated with autism are interpreted. In some cultures, minor deviations from typical behavior might be more accepted. For example, research indicates that adults in countries like Thailand or Jamaica may be less concerned about certain behavioral differences than those in the United States. Similarly, rural communities may normalize behaviors that urban or Western cultures would label as unusual. Cross-cultural studies show that stigma toward autism varies widely. For example, research comparing countries like Lebanon and the United States found that stigma is generally lower in the United States. Factors such as knowledge about autism, positive interactions with autistic individuals, and openness to new experiences can help reduce stigma. However, the relationship between cultural values, such as collectivism, and stigma is complex and not always straightforward. From the viewpoint of autistic individuals, acceptance can also differ across cultures. In societies with lower acceptance, there may be increased pressure to hide autistic traits, which can negatively affect mental health. Internalized stigma or self-stigma can lead to lower personal acceptance and well-being. To effectively reduce autism stigma, it is important to consider cultural context. Some practical strategies include increasing public education that is tailored to specific cultural beliefs and addressing knowledge gaps about autism. Promoting positive and accurate media representations of autistic individuals can also help. Creating autism-friendly environments that respect cultural differences in behavior and communication is essential. Encouraging positive interactions between autistic and non-autistic individuals can challenge stereotypes and foster acceptance. Understanding cultural perspectives on autism is vital for supporting families and autistic individuals. It helps ensure that interventions and support systems are respectful and responsive to cultural differences. By addressing these cultural factors, we can improve outcomes for families affected by autism and promote greater acceptance worldwide.